Hi, this is Jennifer, advice nurse for MyMedLab. When my oldest son was 23 months, he regressed with severe speech delay, global developmental delays, and eventually autism. What I noticed that went along with his behaviors were physical illnesses, such as severe GI tract infections, immune system dysfunction, and I found that when I treated those on an individual basis using biomedical interventions, I was able to recover his speech. His behaviors would diminish, and I was very successful at it. During that time, about 2 years ago, I started using MyMedLab as a patient. I would use them because it was a very cost-effective way for me to get labs whenever I needed them, keep track of his progress. And so when MyMedLab asked me if I wanted to be an advice nurse for autism recovery, I jumped at the chance. I was really thrilled. What I'd like to do is use my experience as a nurse and a parent recovering her son from autism to help people navigate this really difficult and challenging field. I want you to be able to not only understand the lab values, but why you would need this lab or why you wouldn't need this lab. I also want to help you communicate better with your doctors. So I hope that I'm able to share these experiences with you that are working for me and basically get you through this. There is hope. Hi, this is Jennifer, advice nurse for MyMedLab. I wanted to make this video because as a nurse and a mother recovering her child from autism, I'm frequently asked how to make a blood draw easier for a child, especially one with special needs. Well, here's a few tips and tricks. First off, know where you're going and know who's going to be doing the blood draw. On the LabCorp website, you can not only specify the closest lab, but you can also look for a lab that specializes in pediatric blood draws. I also do a trial run. I meet with a phlebotomist, tell them a little bit of what to expect with my child, and ask them if they have any questions. When I'm there, I also take pictures, so when I get home I can print them out and create a social story for my son, so he'll be more used to the environment before we even get there. The next thing that's very important is to always follow instructions that come with your labs. For instance, if it says that you need to fast, then definitely do that fasting. For a child, I suggest that they fast while they're sleeping. So make the lab visit first thing in the morning. Another thing is to keep well hydrated. The more hydrated you are, the easier the blood draw. The veins won't roll. I like to give my 5-year-old son a couple glasses of water half hour to an hour before the blood draw. It seems to work out nicely, but you definitely need a potty break just in case. Don't want any accidents. My very favorite intervention for blood draws is numbing cream. You can get this in prescription form like this is from your doctor. It's called EMLA cream, or you can get an over-the-counter version of a lidocaine-based cream called LMX4. What I do is I apply the cream to the inner elbows right here inside, nice and thick, and then I take a Ziploc bag and I cut a square and I place the square over the cream to keep the cream in place, and then I put a long sleeve shirt over my son so he doesn't fidget and pick at it on the way to the blood draw. It really helps with the pain of the needle prick. The next thing is the actual blood draw. If your child's small enough, have them sit on your lap, and even though you want to be very kind and you're very frightened, you need to remain calm and firm, and you need to hold their arm exactly where the phlebotomist tells you to, and do not let it move. The more still the arm is, the easier the blood draw, so just hold on tight. Finally, be sure to give them a reward, whatever you promise them. For us, it's all about lollipops. So I make sure to find the perfect gluten-free, casein-free lollipop that I get off the internet. It could be a trip to the park, whatever. Just make sure that they get a reward because this is pretty traumatizing. Okay, I hope that this helped make blood draws easier for your child. Thanks so much.